I should say this piece of work is a small component of a larger project that was funded by Safe Food, which has just finished. And I'd like to acknowledge the work of Tara Kenny and Lauren O'Mahony, who did much of the research on this project, and to my colleagues, Mary McCarthy, Jane Woodside and Sinead McCarthy for their collaboration on the overall Safe Food project and for the funding by Safe Food. So firstly, I'd just like to start by stating probably the obvious, that nutritional health is a fundamental resource for our social, cultural, economic well-being of local, national and global communities. However, we're in a current crisis, and Clarissa had mentioned the co-occurring crises of the global syndemics. We have the undernutrition, overnutrition and the climate crisis. With the agri-food sector contributing to over 1/3 of our carbon emissions, as Clarissa pointed out there, there's significant pressure to change our food production and dietary habits for the co-benefit of our population health and our planetary health. And Clarissa mentioned the need for more upstream focus. And I think we really need to move away from the individual blame game, where for many years, much of our efforts have been focused downstream at the individual level, where these efforts and these interventions are politically easy, but there's very high agency at the individual level. And we need to move more upstream, where the policies are, the interventions are politically more challenging, but have a higher population level effect. And we know that these structural government policies do work, and they do make a big and global shift from unhealthy to healthy diets. They play an important role for creating healthy food systems and food environments, and they're a way to affect a larger effect change rather than education alone. They also have the added benefit of being beneficial to improve the dietary intakes for across the populations and for our more vulnerable groups as well. So our global food system is a dynamic system which incorporates and integrates all components from farm to flush. And food decisions from the individuals up to policy level are very relevant for optimum population health and also for environmental health. And we know that action is called for across the food system, from the demand side as well as the supply side. And as many of you probably don't have to point it out here, we do need individual behaviour change, but that alone is insufficient to improve population health improvements. So just to move on, when we talk about sustainable diets, what exactly are we talking about? And this is the definition that was provided in the FAO and WHO document, and that they're dietary patterns that promote all dimensions of individuals' health and well-being. They have low environmental pressure and impact, and are accessible, affordable, safe and equitable, and are culturally acceptable. And I suppose the most important thing is that a sustainable diet must combine all dimensions of sustainability to avoid unintended consequences. And they need to be equally and equitably accessible to all. When we say all dimensions of sustainable diet, what does this mean, or what does this imply? So this figure presents a diagrammatic representation of the components of a sustainable diet as defined by the UN FAO in 2010. And we can see the bolded headings in each petal represent the key components of what a sustainable diet is. And then the text within the petals highlight the multiple determinants, the factors and the processes that influence each of the interconnected components. So I suppose with this in mind, the overall project with Safe Food was to look at the international best practice on building sustainability into national healthy eating guidelines and to focus on the practical implications for policy. So to start out in this project, we explored the degree to which sustainability was incorporated into food-based dietary guidelines in other countries. And we looked at the differences in approaches in incorporating the sustainability into the guidelines, and also to look at the wider policy context to come up with some considerations of, how we can incorporate sustainability into food-based dietary guidelines here in Ireland. The countries we looked at were Brazil, Canada, Sweden, France, Qatar, the Netherlands, and Denmark. Now, they're not the only countries that have built sustainability into food-based dietary guidelines, but at the time we were conducting the research, they were the countries that we were able to access the information, and the information was available in English. So if we look at the process of development and the process of incorporating sustainability into food-based dietary guidelines in these countries, all of these countries based their guidelines on current eating patterns and health challenges, and they all had complementary policies in place and assumed a whole food rather than a nutrient approach. The majority of them did facilitate public consultation, though not all, and they also had workshops during and after the development of the initial draft of the guidelines, and they also pre-tested the guidelines for the development of or for understanding of the guidelines. If we looked at how these guidelines across these countries aligned with existing guidance on how or what should be considered when integrating or creating sustainable food-based dietary guidelines, most of the guidelines spoke to food waste reduction, and all recommended choosing local, seasonal or regionally produced foods. And they all outlined the relationship between food and the environment, but to varying degrees. Some offered guidance specific to the environmental benefits of limiting overconsumption, and only one set, and this was in Sweden, offered advice on which fruits and vegetables to choose over others. With regard to clear guidance on the environmental benefits of limiting overconsumption of all foods, with the exception of Qatar, the advice was specific to highly processed or ultra processed foods. So here, some of them are, we have some rather than yes or no. So that was, I focused on incorporating the sustainability into the guidance, but if we look at the clarity and the certainty in the guidance, so all recommend more plant and less meat, but some countries were more specific than others. So the table here is showing you a range of values denoting certainty and the level of certainty applied to categories of food within the guidance. So red means high uncertainty or lack of clarity, and the dark green means low uncertainty or more clarity about the specific guidance. So, for example, here on the right, you can see that the Netherlands, or in the Netherlands, the red meat recommendations are very, very clear. It's 300 grams of red meat per week. But their processed meat recommendations are less clear. They simply state that these meats are not part of their Wheel of Five and consumption should be limited. The French milk guidelines specify 2 portions a day, with 1 portion of milk being 150 mils or 30 grams of cheese. So again, there's clarity in the guidance. Whereas for example, Brazil here, in terms of their meat, guidance is far more vague and more qualitative. So they have received a lower or a higher scoring. So they have combined meat, eggs, dried legumes, red meats. So again, it's less clear and there's less certainty than when you can compare it to, say, for example, the Netherlands. So in terms of developing and incorporating our sustainability into food-based dietary guidelines, we highlight some general considerations across the various phases in terms of development. So in the first stage, we're suggesting the process should be guided by experts that reflect the multiple dimensions of sustainability and be built upon strong guiding principles. Brazil is a good example in this regard, and current dietary practices and food supply should be considered along with international commitments. An initial survey to capture people's expectations along with the challenges associated with past guidance would also be very useful. And the process should be rationalised with clear statement of intent based on the current challenges. Several countries have employed protective measures to limit potential of vested interests. So, for example, in the case of Sweden, Denmark and the Netherlands, the initial evidence review was carried out by an independent expert committee, and the Netherlands also held an open consultation on the evidence to include in the review. Canada and Sweden were very transparent in documenting their decision-making, and all of the decision-making processes are available online to review. If we look at in terms of the content of the guidance, there does need to be a clear link between each guidance and sustainability, or each guideline and sustainability. And that we need the clear guidance on animal-based foods will be essential. Additionally, consideration of processed and ultra-processed foods in the guidance would be helpful. And it was also highlighted when we were looking at these countries that, and it was mentioned earlier on in relation to breastfeeding, that the health benefits of breastfeeding across the life course and the growing body of evidence, I suppose, concerning the environmental impact of infant formula. With this in mind, that breastfeeding should also be considered within the dietary guidelines and a part of the dietary guidelines. So all of the countries we looked at had supportive policy environments. For example, they had joint human and planetary health objectives within key state bodies in the national bodies, and there was ongoing efforts at the national level to align food production policies with what was being recommended to its citizens. And several countries also had updated or developed their national food policies along with the development of their sustainable dietary guidelines, and these were supported with other educational and awareness campaigns. So some of the challenges, another component of the overall project, which I don't have time to go into here today, looked at the challenges and perceptions from a consumer perspective. And some of the challenges that were highlighted in that scoping review was that the concept of sustainable diets encompasses multiple meanings across different levels. And people found the terminology to capture and measure the ecological impacts of the diet confusing. There was lack of clarity of what a sustainable diet meant. And people tended to underestimate the heaviest environmental burden and tended to overestimate the heaviest environmental burden and underestimate the impact of some particular food groups. So our challenge from a public health perspective is that how can we transition towards the dietary patterns that are healthy for our population, environmentally sustainable, affordable and accessible to all. And with that in mind, what can we do as from an academic or research perspective? And I think it's essential to develop a critical mass to conduct timely research to address these policy gaps across the food system. And we need to start bridging the traditional food research disciplines with planetary health and public health. And I think public health is really well positioned to be that bridge and to help with that bridge. And we need to increase the evidence base to inform future food and nutrition policies to safeguard population health. And finally, before I finish up, I just want to a shameless plug of a new research project, a Horizon Europe project that just started earlier in this year. It's the food systems that support transition to healthy and sustainable diets. Is the FEAST project. I don't have time to go into it, but I would just flag the website here if you want to find out more of our work. We're going to be working across the food chain, and in the School of Public Health, we're particularly going to be contributing to the food environment work and work package 3 and looking at some of the consumer behaviour. So finally, to leave you with a slide from a mentor of mine, Professor Ivan Perry, who likes to, he states, a quote from Michael Pollan: "Eat real food, not too much and mostly pants, and food that your great mother would recognise." So I'd like to leave it there, and thank you for listening.